There's nothing like that big, wet, slobbery dog kiss, especially first thing in the morning. But it's not as pleasurable if there's a serious case of doggy breath going on. Veterinary dentist Dr. Cindy Charlier says that bad breath is a bad sign for our dogs and cats.
Yeah, it's really not normal for dogs to lose their teeth and for dogs and cats to have dog and cat breath. And so what happens as pets age, if they haven't had any preventive oral care, their teeth get worse and worse and worse. And periodontal disease not only affects what goes on in their mouth, but affects their whole body.
It's not just the bad breath that's a concern. Oral care is truly important for the overall health of your pet.
We know that based on some studies that have been done, that with increasing amount of periodontal disease, we have increasing changes in the heart, liver, and kidneys. So what I tell my clients, and this sounds funny, but what I tell my clients is the dog or cat's head's attached to the rest of the body. So what goes on in the head is going to affect their whole entire body. And unfortunately for our pets, they can't raise their paw and say, "Mom, Dad, my mouth hurts, take me to the veterinarian or the veterinary dentist." And so their instincts to survive, you go to the bottom of the pack. And they have pain and deal with pain, oral pain, on a regular basis. And owners don't know it, and it goes unrecognized unless it's recognized by your veterinarian.
That gunk, and that is a technical term, that starts to build up on your pet's teeth is really about the same as what would build up on our teeth if we did not brush and did not see our dentist.
Plaque is the stuff that we wake up with and feels like we have socks on our teeth in the morning, and that's clear, and we brush it away, and our dogs and cats don't do that, and then it becomes calculus or tartar. And so the plaque has bacteria in it, and then as it becomes calculus, that bacteria sneaks up under the gum line. And when it sneaks up under the gum line, it causes bone loss and gum recession, and then it gets circulated through the body and can cause issues other places. So the older dogs and cats are the dogs and the patients that have heart, liver, and kidney disease as they get older. They're actually the most important patients for us to deal with their mouth, so that those organs that are already compromised don't get further compromised. Once the owners notice that there's hard brown stuff on their dog or cat's teeth, or that they have any redness to their gum tissue, then that's a sign that they need a professional dental cleaning under general anesthesia with their veterinarian.
Well, some owners worry that dental work can be painful in of itself to our pets. The truth is that the pain comes from living day to day with dental problems.
What I tell my clients is I would rather have a dog or cat that's toothless and pain-free than a dog or cat with all their teeth that's painful. So that's what we need to keep in mind. I've got plenty of patients that have no teeth and they eat just fine and they're happy. And it all goes back to properly diagnosing oral disease. So we need to look at what they look like clinically with my eyeballs, but then we need to take radiographs because a lot of the disease process occurs under the gum line around the tooth roots. And what I tell my clients is my bifocals are good, but I can't see under the gum line. So we combine what we see clinically with what we see radiographically. And so for my dogs, I'm really treating 42 patients at a time because they have 42 teeth. And for cats, I'm treating 30 patients because they have 30 teeth. So we'd rather have no teeth and pain-free than all their teeth and painful.
There are lots of things you can do. Regular brushing, well, that helps. Also the use of lots of products. Here are two. OraVet Dental Chews or CET Chews. They help maintain oral health. Ask your veterinarian about what's right for your pet. See your veterinarian twice a year so your veterinarian can say, "Open wide," and maybe, I hope, your veterinarian can x-ray those teeth as well. Your healthy pet will keep smiling, and you'll smile when you get that big wet dog kiss. I'm Steve Dale.